एवरीवन, सो वेलकम बैक टू माय चैनल नर्सिंग की पार्ट 5 जो हमारी वीडियो का लास्ट पार्ट है। इसमें जितने भी रिमेनिंग क्वेश्चंस थे उनको कवर कर लिया है। तो अगर आपको इन सारे क्वेश्चंस में कोई भी डाउट होगा तो कमेंट बॉक्स में बताना। सो लेट्स स्टार्ट विद द क्वेश्चंस। एब्सेंस ऑफ विच क्लॉटिंग फैक्टर लीड्स टू हीमोफीलिया ए? ऑप्शन ए फैक्टर 7, ऑप्शन बी फैक्टर 8, सी फैक्टर 9, D factor 10. So correct option is B factor 8. So hemophilia A is a hereditary bleeding disorder caused by a lack of blood clotting factor 8. Without enough factor 8, the blood cannot clot properly to control bleeding. Question 102. Volume of urine is regulated by A. ADH, B. Aldosterone, C. ADH and aldosterone, D. Aldosterone and testosterone. So correct option is C. ADH and aldosterone. So question 103. Which cells produce insulin? A. Alpha cells, B. Beta cells, C. Delta cells, D. F cells. So correct option is B. Beta cells. तो 2 टाइप के सेल्स होते हैं आइलेट्स ऑफ लैंगरहैंस में, जिनको हम कहते हैं अल्फा सेल्स एंड बीटा सेल्स। तो जो हार्मोन सिक्रीट करता है अल्फा सेल्स उसको हम कहते हैं ग्लूकागोन, और जो बीटा सेल्स होता है वो कौन सा हार्मोन रिलीज करता है, दैट इज इंसुलिन। नेक्स्ट इज क्वेश्चन नंबर 104. सिक्रीशन ऑफ पैंक्रियाटिक जूस इज स्टिमुलेटेड बाय A. gastrin, B. secretin, C. enterokinase, D. enterogestrone. So correct option is B. secretin. So secretin एक मोस्ट इम्पॉर्टेंट हार्मोन है डाइजेस्टिव ट्रैक्ट का, जो क्या करता है, पैंक्रियाज को स्टिमुलेट करता है फॉर द सिंथेसिस एंड सिक्रीशन ऑफ नॉन एंजाइमेटिक पार्ट ऑफ पैंक्रियाटिक जूसेस. Secretin also stimulate liver for secretion of bile juice and inhibit the gastric acid secretion in stomach. So next is 105. The lytic enzyme released by sperm is A. hyaluronidase, B. acrosome, C. ligase, D. androgamone. So the lytic enzyme released by sperm is hyaluronidase. So correct option is A. Question 106. All the following bones contribute to the formation of nasal septum except A. sphenoid, B. lacrimal, C. palatine, D. ethmoid. So correct option is B. lacrimal. So lacrimal ही एक ऑप्शन है जो फॉर्मेशन ऑफ नेजल सेप्टम में कंट्रीब्यूट नहीं करता है. So yes, correct option is B. Next is question number 107. Immunoglobulin which crosses placenta is A. IgG, B. IgD, C. IgM, D. IgE. So correct option is A. IgG. So IgM, IgE and IgD are excluded from crossing the placenta, and IgG is the only antibody जो कि human placenta को cross करता है. Next question number 108. The gland that is located in hypophyseal fossa of sphenoid bone is A. adrenal gland, B. thyroid gland, C. pituitary gland, D. thymus gland. So correct option is C. pituitary gland. The pituitary gland is within the sella turcica or hypophyseal fossa. So next is question 109. Synthesis of glucose from non-carbohydrate source is referred as A. glycolysis, B. gluconeogenesis, C. glucogenolysis, D. glucogenolysis. So correct option is B. gluconeogenesis. So gluconeogenesis क्या होता है? Neo means new. So synthesis of new glucose from non-carbohydrate precursors जो क्या प्रोवाइड करते हैं ग्लूकोज when dietary intake is insufficient or absent. Question number 110. Which of the following muscle is known as peripheral heart? A. polyteus, B. soleus, C. gastrocnemius, D. gluteal. So correct option is B. soleus. So soleus को peripheral heart क्यों कहते हैं? बिकॉज सोलियस रिस्पॉन्सिबल होती है to pumping venous blood back into the heart from the periphery. So इसे हम skeletal muscle pump भी कहते हैं और peripheral heart भी कहते हैं. So this is the correct option. Next is question number 111. A nurse is monitoring a client in active labor and notes that client is having contractions every 3 minutes that last 45 seconds. The nurse notes that the fetal heart rate between contraction is 100 beats per minute. Which of the following nursing action is appropriate? A. Notify the physician or nurse midwife. B. Continue monitoring the fetal heart rate. C. Encourage the client to continue pushing with each contraction. D. Instruct the client's coach to continue to encourage breathing techniques. So आप क्वेश्चन में देख रहे हो कि जो फीटल हार्ट रेट है वो कॉन्ट्रैक्शन के टाइम पे 100 बीट पर मिनट हो रहा है, लेकिन जो नॉर्मल फीटल हार्ट रेट होता है वो होता है 120 to 160 बीट पर मिनट. तो मीन्स अगर 100 बीट पर मिनट उसका फीटल रेट है तो इट मीन्स कि फीटल ब्रेडिकार्डिया हो रहा है. तो अगर फीटल ब्रेडिकार्डिया हो रहा है कॉन्ट्रैक्शन के बीच में तो इट नीड्स इमीडिएट मेडिकल मैनेजमेंट. तो हम क्या करेंगे, जो भी वहाँ पे फिजिशियन या नर्स मिडवाइफ होंगे उन्हें इन्फॉर्म करेंगे. सो करेक्ट ऑप्शन इज ए, नोटिफाई द फिजिशियन एंड नर्स मिडवाइफ. नेक्स्ट इज क्वेश्चन नंबर 112. अ मदर ऑफ अ 3-year-old टेल्स अ क्लिनिक नर्स दैट द चाइल्ड इज rebelling constantly and having temper tantrums. Using Erikson's psychosocial development theory, the nurse tells the mother to A. Set limit on the child's behavior. B. Ignore the child when this behavior occurs. C. Allow the behavior because this is normal at this age period. D. Punish the child every time the child says no to change the behavior. So correct option is A. Set limit on the child's behavior. So next is question number 113. An adolescent client with type 1 diabetes mellitus is admitted to the emergency department for treatment of diabetic ketoacidosis. Which assessment finding should the nurse expect to note? A. Sweating and tremors. B. Hunger and hypertension. C. Cold, clammy skin and irritability. D. Fruity breath odor and decreasing level of consciousness. So डायबिटिक कीटोएसिडोसिस एक कॉम्प्लिकेशन है डायबिटिक मेलाइटस की, जिसमें क्या होता है कि सीवियर इंसुलिन डेफिशिएंसी हो जाती है. हाइपरग्लाइसेमिया होता है डायबिटिक कीटोएसिडोसिस के साथ, और हाइपरग्लाइसेमिया के जो साइंस है वो है फ्रूटी ब्रेथ ऑर्डर एंड अ डिक्रीजिंग लेवल ऑफ कॉन्शियसनेस. सो करेक्ट ऑप्शन इज डी, फ्रूटी ब्रेथ ऑर्डर एंड डिक्रीजेस लेवल ऑफ कॉन्शियसनेस. हंगर जो है वो हाइपोग्लाइसेमिया का साइन है, बट हाइपरटेंशन इज नॉट अ साइन ऑफ डायबिटिक कीटोएसिडोसिस. सो हाइपोटेंशन occurs because of decrease in blood volume related to the dehydrated state that occurs during diabetic ketoacidosis. Cold, clammy skin and irritability, sweating and tremors, ये भी hypoglycemia का sign है. So next is question 114. A nurse is instructing the mother of a child with human immunodeficiency virus (HIV) infection regarding immunization. Nurse tells the mother that A. The hepatitis B vaccine will not be given to a child. B. The inactivated influenza vaccine will be given yearly. C. The varicella vaccine will be given before 6 months of age. D. A Western blot test needs to be performed and the results evaluated before immunization. So correct option is B. The inactivated influenza vaccine will be given yearly. So next is question number 115. The most appropriate time for the nurse to obtain a sputum specimen for culture is A. After aerosol therapy. B. Early in the morning. C. After the patient eats a light breakfast. D. After chest physiotherapy. So ideally जो specimen होता है वो morning में collect करना चाहिए. So correct option is B. Early in the morning, because in the morning as secretions pull in the lung overnight, providing an environment in which bacteria can replicate. So yes, correct option is B, in the morning. Next is question number 116. Probability of making type 2 error in any statistical test is termed as A alpha, B beta, C gamma, D delta. So correct option is B beta. Next is 117. Which scale of measurement has A absolute 0? A nominal, B ordinal, C interval, D ratio. Correct option is D ratio. So next is question number 118. Cholesterol value are obtained in a group of people before and after giving drugs. The appropriate statistical test used to analyze the data is A paired t-test, B unpaired t-test, C Fisher's test, D chi-square test. So correct option is A paired test. So next is question number 119. The degree of consistency with which an instrument measures the attribute it is supposed to be measuring is called A validity, B reliability, C sensitivity, D objectivity. So correct option is B reliability. Next is question number 120. Random sampling is a probability sampling which include all the following techniques except A simple random sampling, B stratified random sampling, C cluster sampling, D purposive sampling. So correct option is D purposive sampling. So हमारे पास सैम्पलिंग मेथड में दो तरह की सैम्पलिंग टेक्निक्स होती है, प्रोबेबिलिटी सैम्पलिंग, नॉन प्रोबेबिलिटी सैम्पलिंग. प्रोबेबिलिटी सैम्पलिंग में सिंपल रैंडम सैम्पलिंग आता है, स्ट्रेटिफाइड सैम्पलिंग आता है, सिस्टेमैटिक सैम्पलिंग आता है और क्लस्टर सैम्पलिंग आता है. नॉन प्रोबेबिलिटी सैम्पलिंग में हमारे पास पर्पसिव सैम्पलिंग आता है, क्वार्टर सैम्पलिंग आता है, जजमेंट सैम्पलिंग आता है, स्नोबॉल सैम्पलिंग आती है एंड कन्वीनियंस सैम्पलिंग आती है. सो जो हमारे पास इसमें दिया था कि प्रोबेबिलिटी सैम्पलिंग, तो प्रोबेबिलिटी सैम्पलिंग में पर्पसिव सैम्पलिंग नहीं आती और जो तीन ऑप्शंस हैं वो सारी सैम्पलिंग मेथड जो है वो आते हैं. So next is question number 121. Cognitive domain in Bloom's taxonomy includes all the following except A evaluation, B synthesis, C analysis, D criticism. So Bloom's taxonomy में evaluation, synthesis and analysis आता है. जो नहीं आता वो है criticism. So correct option is D criticism. So आप Bloom's taxonomy में देख सकते हैं पिक्चर में क्या क्या आता है. So evaluation, synthesis, analysis, application, comprehension and knowledge. So this is the Bloom taxonomy. So next is question number 122. According to which philosophy of education, childhood is something desirable for its own sake and children should be children? A idealism, B pragmatism, C naturalism, D realism. So correct option is C naturalism. So next is question number 123. A team of nurses was assigned to teach the community regarding hazards of smoking, alcoholism. Which method of teaching is most useful? A demonstration, B seminar, C puppet show, D lecture method. So correct option is C puppet show. Puppet show is the most useful method to teach the community regarding hazards of smoking and alcoholism. So next question is question number 124. Nursing profession can only be practiced after A approval, B evaluation, C licensing, D accreditation. So correct option is C licensing. तो एज यू ऑल नो कि आप नर्सिंग प्रोफेशन में तभी प्रैक्टिस कर सकते हो जब आपके पास आपका लाइसेंस होता है, आपके पास आपका रजिस्टर्ड नर्स का RN RM नंबर और लाइसेंस आपके पास होता है. सो करेक्ट ऑप्शन इज सी लाइसेंसिंग. So next is question number 125. A study of organizational behavior mainly involves the study of A individuals and groups, B buildings, C structures, D departments. So correct option is A individuals and group. So next question is question number 126. The site of action of the loop diuretic furosemide is A thick ascending limb of loop of Henle, B descending limb of loop of Henle, C proximal tubule and D distal tubule. So correct option is A thick ascending limb of loop of Henle. Question number 127. The most significant adverse effect of ACE inhibition is A hypotension, B hypertension, C hypocalcemia, D hypercalcemia. So So correct option is A, hypotension. Next question is question number 128. Which of the following is a thrombolytic agent? A, aspirin, B, streptokinase, C, clopidogrel, D, ticlopidine. So correct option is B, streptokinase. Next is question number 129. Trisomy 21 is otherwise called A, Klinefelter syndrome, B, Turner syndrome, C, sickle cell anemia, and D, Down syndrome. So trisomy 21 is also known as Down's syndrome. So correct option is D. Next question is Mendel's first law is law of A, paired factor, B, dominance, C, segregation, D, independent assortment. So correct option is C, segregation. Question number 131. A nurse is caring for a client with Wernicke-Korsakoff syndrome. The patient is advised to consume thiamine-rich food. The nurse instructs the client to increase the intake of which food items? A, chicken, B, milk, C, pork, D, broccoli. So correct option is C, pork. Question number 132. Which enzyme helps for the digestion of fat after emulsion? A, renin, B, amylase, C, lipase, D, trypsin. So correct option is C, lipase. Question number 133. Which of the following is used for grading protein energy malnutrition? A, Ballard scales, B, Gomez scale, C, Bishop scoring, and D, Cramer's rule. So correct option is B, Gomez scale. 134 question. During catabolism, only about 40% of the energy available from oxidizing glucose is used to synthesize ATP. Remaining 60%, A, is lost as heat, B, is used to reduce NADP, C, remains in the products of metabolism, D, is stored as fat. So correct option is A, is lost as heat. Question number 135. The process of transfer of heat in liquid and gases is called A, conduction, B, radiation, C, convection, D, absorption. So correct option is C, convection. कंडक्शन में जो हीट ट्रांसफ़र होती है वो होती है फ्रॉम वन सब्सटेंस टू अनदर सब्सटेंस बाय डायरेक्ट कांटेक्ट, और जो रेडिएशन है उसमें जो एनर्जी होती है वो रेडिएट होती है और ट्रांसफ़र होती है वाया रेज और वेव्स और पार्टिकल्स, और वी कैन से इट ट्रांसफर्ड इन द फॉर्म ऑफ रेज. Next question is question number 136. In malaria, the form of plasmodia that is transmitted from mosquito to human is the A, sporozoite, B, gametocyte, C, merozoite, D, hypnozoite. So correct option is A, sporozoite. 137. Each of the following organism is an important cause of urinary tract infection except A, Klebsiella pneumonia, B, Escherichia coli, C, Bacteroides fragilis, D, Proteus mirabilis. So correct option is C, Bacteroides fragilis. Question number 138. How many doses of tetanus toxoid should be given to a pregnant woman who is not vaccinated for tetanus previously? A, 1, B, 2, C, 3, D, 4. So correct option is 2. Question 139. Which of the following bacteria can be present normally in the conjunctiva? A, Corneobacterium xerosis, B, Staphylococcus epidermidis, C, Moraxilla species, and D, all of the above. So correct option is all of the above. Next is question number 140. Which of the following medium can be used as transport medium for Vibrio cholera? A, nutrient broth, B, Venkataraman Ramakrishna medium, C, Selmite F broth, D, none of the above. So correct option is B, Venkataraman Ramakrishna medium. So this medium can be used as a transport medium for Vibrio cholera. So next question is question number 141. Ivan Pavlov proposed the concept of A, operant conditioning, B, classical conditioning, C, learning by trial and error, and D, learning by insight. So correct option is B, classical conditioning. Question 142. The stages of general adaptation syndrome progress in which of the following stages? A, resistance, exhaustion and alarm, B, alarm, exhaustion and resistance, C, alarm, resistance and exhaustion, D, exhaustion, alarm, resistance. So correct option is C. First is alarm, then resistance, and then exhaustion. Next is question number 143. Which of the following is not a factor affecting social change? A. Forestation, B. Industrialization, C. Urbanization, D. Technology and discovery. So correct option is A. Deforestation. Next is question number 144. Social stratification implies A. Social equality, B. Social justice, C. Social inequality, and D. Social injustice. So correct option is C. Social inequality. Next is question 145. The rule that one must marry within one's own caste is called A. Exogamy, B. Endogamy, C. Monogamy, D. Polygamy. So correct option is B. Endogamy. Question 146. Which of the following crop types are affected generally positively by Western India? A. Rabi crop, B. Kharif crop, C. Jaid crop, D. None of these. So correct option is A. Rabi crop. Question 147. The Berne Convention was pioneer convention in the field of A. Protection of wildlife, B. Protection of victims of wars, C. Protection of intellectual property rights, D. Protection of human rights. So correct option is C. Protection of intellectual property rights. Question 148. Each year World Red Cross and Red Crescent Day is celebrated on A. May 8, B. May 18, C. June 8, D. June 18. So correct option is A. May 8. So question 149. Headquarter of UNO is situated at A. New York, USA, B. Hague, C. Geneva, D. Paris. So यूनाइटेड नेशन ऑर्गेनाइजेशन का जो हेडक्वार्टर है वो है न्यूयॉर्क में. सो करेक्ट ऑप्शन इज ए. न्यूयॉर्क. Last but not least, question number 150. Who became the first Indian woman scientist to be awarded fellowship of the Royal Society, United Kingdom? A. Rohini Godbole, B. Aditi Pant, C. Gagandeep Kang, D. Tessie Thomas. So correct option is C. Gagandeep Kang. So ये हमारे 150 क्वेश्चंस थे जो MSc का एंट्रेंस एग्ज़ाम था 2019 का. सो अभी हमारे सारे क्वेश्चंस जो है MSc के 2019 के क्वेश्चन पेपर के ख़त्म होते हैं. अगर आपको कुछ समझ नहीं आया हो तो प्लीज़ मुझे कमेंट बॉक्स में बताइए. थैंक यू ऑल फॉर वॉचिंग माई वीडियो. बाय बाय.